Good afternoon, everybody, or good morning, depending where you're at. Thanks for joining us today at this webinar, and we're really hoping that you're gonna enjoy it and you're gonna go home with something really useful. We are very excited to be presenting a new product suite that we released not that long ago. And today we are going to talk about how that new product suite will help healthcare organizations revolutionize the ways how they take appointments. So my name is Anna Kocsis. I work on kind of the customer facing and business analyst side of the business. I carry out interviews, case study gathering campaigns, feedback campaigns. And today's host is Jacob Buckland. So Jake, I'm just going to hand over to you to introduce yourself and start the show.
Great, thanks very much, Anna. I really appreciate it. Hi everyone, hope everyone is doing well and enjoying the sunshine or hating the rain, depending on where you are in the world. I'm Jacob, as Anna mentioned, and I am the head of business transformation at 10 to 8. Now, I think that's just a very fancy way of saying that I'm in charge of the team that manages the pre-sales implementation of 10 to 8 within different healthcare organizations. That ranges from over 100,000 businesses around the world. But in this context, we're going to be talking specifically about accessibility and talking about how 10 to 8 can make your booking pages, your products, and your business more accessible to those who need it most. So let's get started. Well, what are we going to cover? Well, I just mentioned a little bit, a very large headline, but narrowing that down a little bit, we're going to be covering why is accessibility important, the story behind the accessibility suite and why we went forth and decided to develop this, what it includes, what is inside of this accessibility suite within functionality, benefits for your patients and medical practices, sneak peek demonstration, and then some Q&A as well. So why accessibility? I think it's a really important question and something that, although this should be something that everybody is looking at, before embarking on a large project, something that we always like to ask ourselves and our clients is why accessibility? Why are we doing this? Why is this important and why now? Well, the data really speaks for itself, to be honest with you. 15% of the world's population have a level of disability, 3.5% are blind or have MSVI, and 5% have hearing loss or a level of disabling hearing loss. Only 1% of the top million homepages on the web meet this widely used accessibility standard. Now, that says a lot, doesn't it? Though all those numbers there don't particularly add up as what we found. And the really important part of 10 to 8 for us is that we make it accessible for anyone and everyone, no matter what level of ability they have to make those bookings themselves, but also what level of access they have to different software tools. So this became really apparent for us as we've been working with lots of healthcare organizations over the last year, especially over the course of the pandemic, and 10 to 8 has become more applicable and more worldwide than ever. This just became more and more important. And that was really why we decided to embark on this mission. So what's the idea behind the new suite? Well, I could talk about it, or we could let our head of product, Richard, talk about it. He is the man behind the ideation and the management of the product suite, and also a lot of the business vision as well.
The idea for this new product suite came from a very personal story. So there are two sisters who are friends of mine, Kate and Jane, and they both suffer from the same medical condition. Unfortunately, they both suffer from rheumatoid arthritis. So they require biological therapy and a special set of medications to keep their conditions under control, as well as regular blood tests and visits to the hospital. Kate has a milder version, and her elder sister, Jane, has a more severe version of the illness. She also has to use a mobility scooter as she has trouble getting around. Now, Kate is more familiar with technology, so she can book her blood tests and her doctor's appointments online. She also knows that the new appointment slots become available at 8 p.m. in the evening. So it's easy for her to go and find the best time just by visiting the website and finding it. Jane, on the other hand, she only books appointments over the phone. She doesn't have a computer. We only recently got her a mobile phone. So she has to call up early in the morning and often has to wait 15 or 20 minutes in a queue before she gets to talk to the receptionist, before she's offered the slots, offered the times. And by that point, most of the best slots have gone. Now, due to her reduced mobility and the fact that she lives in a fairly rural area, getting to the appointments is difficult. There's limited transportation and bus options. So it's very difficult for her to find a time that's suitable, which fits with the schedule. And she often misses them due to unforeseen circumstances. So even though Kate has the milder condition, she ends up getting the higher quality healthcare. Jane, who has the more serious condition, well, she either has to ask Kate to help with the booking online, or she's sitting in the queue waiting for the appointment. And in the worst case, she misses out on healthcare completely. So I thought, we can solve this problem. So that's what we did.
Awesome. Well, that's sort of a lovely little bit of information there from Richard, sort of, discussing the why with 10 to 8 and why we've done it, and really how important it is to us, not just from a business and commercial perspective, but from, the people that we know and love, and making sure that we're delivering a service that we believe would be valuable to them, as well as valuable for the millions of people that use our products every day. So just moving on from that, what is the accessibility suite, and what are the solutions, that we just discussed based on the problems that Richard raised? Well, here are the basics. It's omnichannel. So omnichannel is a bit of a buzzword, but that means it's available across all platforms, be it phone, be it online, be it via email, be it via website. Anything to do with online booking or booking in general, 10 to 8 can manage, and which is fantastic. Having everything go into one final place and manage availability from one singular place, but have it available in different areas, is absolutely vital as part of this. It's WCAG or WCAG, depending on how you want to talk about it, compliant. Some of you may or may not know, all government websites have to comply with this. It's really, really important. And this is something that we're actually hoping that more and more businesses adopt over time. Omnichannel accessible reminders. So that could be direct phone reminders, that could be SMS reminders, that could be email reminders. All of these things really, again, really important. Any form of access that they have to any form of technology, 10 to 8 needs to be able to reach out to them. We are available in 120 countries and territories and in over 20 languages. Now, one of the beautiful things about 10 to 8 and our client base is that we're based all around the world. Unfortunately, I'm limited to my very poor English and I think a little bit of French maybe. But all in all, we've got a brilliant team that's always looking at how we can expand and offer 10 to 8 across more geographics, which is absolutely brilliant. So online and phone equals accessible scheduling. I think that sort of speaks for itself. We have a lot of clinics that often triage appointments or book appointments from their sort of central administrative desk. The appointment making here, your phone ringing all day, just to book appointments. You're looking for slots and looking for times that they can get booked in. Well, actually 10 to 8 can automate that process with a 24/7 phone line, so that your receptionist and your administrative team can concentrate on things you need them to be working on within your practices. Saves money, saves time. It's more profitable over time, of course, because you're giving your patients a better service. You're accessing your availability more readily. You're optimizing your way your availability is managed. And it really is as simple as that. Having WCAG-compliant booking pages, you can specify who should visit them, really important. And adding automated phone bookings to make your scheduling process fully accessible. Again, it's just all vital. It's this omni-channel thing we were just discussing around making these things accessible for all people at all times. You can see some examples here. We've got online booking pages, we've got internal bookings, we've got student bookings, we've got phone number bookings, all of those things, all available, all ending up in the same place, which is, again, really, really vital. So what are the benefits for your medical practice, for your patients, for everybody involved? Well, it's quite simple, really. Again, we've broken it down nicely, and it's easy to use and implement. It's not something that's difficult to set up. It won't take months and weeks. It will take days, if that. Minimize training, seamless integration with your existing tools, no interruption of your existing workflows, more automation and less admin. I mean, admin's, the bane of all of our lives, isn't it, really? And automated omnichannel appointments over the phone and online, reminders via SMS, email, and voice calls. Everything is going to be managed by 10 to 8 in our accessibility suite, making sure that your patients and clients are going to be well looked after, but you don't have to be, connecting with them at every touch point with a high human cost. Well, trusted by over 100,000 medical practices and other organizations worldwide. We spoke about this right at the start, but 10 to 8 is here to help. We've got our in-house customer support and onboarding team. My team specifically is responsible for onboarding, and then we've got a fantastic customer support team, really the best in the business. We've got trusted capacity and load management. People ask us, well, how many people can use that phone line at one time? As many as you want is the answer to that question, quite simply. And we're a secure platform. We have all the relevant acronyms and coverage that we need across HIPAA, CCPA, GDPR. We have the relevant reports that you could need and that you would like to see and need access to as well. So from an IT security standpoint, you're again with the best in the business. So what are the benefits for your patients, the people that really count, people that really matter? Well, it's accessible for everybody, the elderly, those who are perhaps non-tech savvy, maybe aren't used to an online booking process. Maybe they're used to speaking to someone or calling the same number. The disabled, those not readily able to make bookings themselves. It's safe and secure. It's contactless patient appointment scheduling, remote check-in, automated bookings, secure data storage. Simple as that. And the most important thing, again, improved patient experience. We're making a new experience for everybody in the 21st century, and that's the whole thing. Technology doesn't have to be limited to those who know how to use it. It's about those who making it available for everybody, improving their experience and improving their engagement. Just to talk a little bit about our Omnichannel platform, we make the entire scheduling process accessible. It's WCAG compliant, it's queueless, it's Omnichannel, and it's highly secure. Better patient experience, less admin. It's totally automated, and we've got voicemail, text transcripts as well for the staff calendar view. 10 to 8 brings all of the sort of previous technologies and modern technologies together in a way that really does benefit the patient, which is really important. So here's an example. If you're based in the UK, if not, we can get you a US number as well, wherever you want to try and use this. We want to make appointments happen for everybody. We want to give you some examples. And I think, Anna, you're going to walk us through using a phone near you, I believe. And you're going to show us how to use the phone scheduling tool.
Yeah, exactly. So what will happen now is I'm going to call this number on the screen. This is a UK number, and we are going to share what happens if you call this number. And I'm just going to put it on speakerphone, and hopefully you will be able to hear it.
You have reached 10 to 8 Accessibility Suite. We offer 3 services. Press 1 for example blood test. Press 2 for example X-ray. Press 3 for discovery call with 10 to 8. Press 0 to hear the services again. You have selected discovery call with 10 to 8. There are appointments available on Monday, the 26th of July. There are also appointments available later in the week. Press 1 to select Monday, the 26th of July. Press 2 for days later that week, or press 3 to try a full week later. There are appointments available on Tuesday, the 27th of July. There are also appointments available later in the week. Press 1 to select Tuesday, the 27th of July. Press 2 for days later that week, or press 3 to try a full week later. You have selected Tuesday, the 27th of July. There are 5 times available. Press 1 for 9 a.m. Press 2 for 10:40 a.m. Press 3 for 12 p.m. Press 4 for 1 p.m. Press 5 for 2:40 p.m. Press 6 for later in the week. Press 0. You have selected 12 o'clock. Now, please say your name.
Anna Kocsis.
Thank you. Just to confirm, you want to book a 20-minute discovery call with 10 to 8 at online. Phone on Tuesday, the 27th of July at 12 p.m. To confirm, press 1. Thank you. Your appointment is confirmed for Tuesday, the 27th of July at 12 p.m. Goodbye.
And that's it.
Lovely. And it's as simple as that, really, which is great to see. And you can see how that's usable by anyone, which is fantastic, alongside having online booking forms, alongside being able to make bookings more accessible for your staff members to make internally as well. Show that we're just creating a channel, and we're creating a space where everybody can get a really good level of service without you having to increase your human capital costs, and also making sure that your patients aren't being confused by having to use a really complex system, which is not really fulfilling its need around giving them that better patient experience.
That kind of brings us to the end of this this presentation and this session. Thank you very much, everybody, for joining us today. We will send out the recording via email, so you can share it with your colleagues or just rewatch it, and you can make sure that it gets in front of the people who think that accessibility is indeed important and can see how it works with your business. Thank you very much for your time, Jake, today, and for the lovely presentation, and I hope to see you next time.
No worries. Thank you so much, everyone. Really appreciate it. Have a lovely day.